Our topic is body temperature. So what is body temperature? So a body temperature is a balance between the internal and the external environment of the body. So internal means inside the body and external, that is something outside of our body, that is our environment. Now it is the balance between the heat production by the body and the heat loss from the body. So the temperature is an production of the heat from the body and in what amount the heat is being lost from the body. And the temperature is measured in the unit that is called degree. Now there are two types of body temperature. First is core temperature and second is surface temperature. So here core temperature, it is a temperature of the deep tissues of the body such as cranium, thorax, abdominal cavity and the pelvic cavity. So these are the parts of the body that are located inside the body. So the temperature that is measured in deep down the tissues of the body, that is known as the core temperature, and it remains relatively constant, that is 37 degrees Celsius or 98 degrees Fahrenheit. And the accurate measurement is usually done using a pulmonary catheter. So basically the temperature taking procedure is being done by the thermometer, but for an exact or accurate measurement, pulmonary catheter is used to take an core temperature. Now, surface temperature. So, surface temperature is a temperature of the skin, that is for the subcutaneous tissues and the fat. So, this is the temperature that is for the skin or the subcutaneous tissue, that is the layers of the skin and the fat. So, it constantly rises and even falls in a relation to the environment. So, this surface temperature depends upon the environment. So, it rises and falls in related to the environment, and it varies from 20 degrees Celsius to 40 degrees Celsius. Now, what are the factors that affect the heat production? So, what all the factors that affect the heat production are listed as below. First is BMR, that is the basal metabolic rate. So basal metabolic rate is a rate of energy that is being utilized in the body required to maintain an essential activity. So the body requires an energy or utilizes an energy for an essential activities, okay, or essential movements, that is breathing, walking, speaking and other such activities. So for doing such activities, the body requires a rate or amount of energy. So that rate or amount of energy that is being utilized is known as basal metabolic rate. Now basal metabolic rate decreases with age. Okay, as the age is being increased, the metabolic rate gets decreased gradually. Now second is muscle activities such as shivering increases metabolic rate. So shivering, that is feeling cold, that would increase the basal metabolic rate. Now example walking or jogging, etc. Now thyroxine output. Third point is thyroxine output, that is increase in thyroxine hormone that increases the rate of cellular metabolism throughout the body. So if in the body the thyroxine hormone is increased or secreted in more amount, so that thyroxine hormone will increases the cellular metabolism rate. So that will increase the temperature. Now, this is also known as chemical thermogenesis. So, the stimulation of the heat in the body through increases in the cellular metabolism. So, the chemical thermogenesis is something that is being increased due to cellular metabolism by the stimulation of the heat production by the chemicals or the hormones that are being changing or secreting in our body. Now fourth is sympathetic stimulation. The release of epinephrine and non-epinephrine thus increases the rate of cellular metabolism. So here the release of epinephrine and non-epinephrine hormone that will increases the rate of the cellular metabolism in our body. So as the number of or the hormone is being increased in the body, the secretion of the epinephrine and non-epinephrine hormone is increased. That will gradually increases the rate of the cellular metabolism in our body. Next, fever. It will increase the metabolic rate and thus increases the body temperature. Okay, so as if we get fever, the metabolic rate will get increased and thus the body temperature also will increase gradually. Now, in what kind the heat is being lost from our body? So first is radiation. So it is the transfer of heat from the surface of one object to surface of another without contact between the two objects. So here the radiation is the process by which the surface of all the objects or a one object heat gets emitted out in a form of an electromagnetic wave, and so the rate of these emissions depends upon the temperature of the surface. So the rate of emission, so the heat loss, the rate of the heat loss that gets emitted through the body, it depends upon the temperature of our body surfaces, and the rate of the heat loss depends upon the temperature difference between the skin surface and the environment. So here it depends upon the surface of temperature surface of the skin as well as the temperature of our environment. Now second is conduction. It is the transfer of the heat from one molecule to another. Example, the body is immersed in ice water. So here conduction is a gain or a loss of heat. So either the heat is gained or lost due to some transfer of thermal energy in our body during the between the adjacent molecules. So there is the transfer of the molecules thermal energy between the molecules, and the body surfaces loses or gains some of the heat by the conduction through the direct contact with a cooler or a warmer object respectively. So if the body is immersed in cold water, then there will be a transfer of heat from one molecule to another, and if the body is immersed in the hot water, the same process will be continued. The one molecule will be transferred from another. Now convection. So it is the dispersion of heat by the air current. So it is a process in which conductive heat is aided by a movement of the air or water next to the body. So if there is some of the air in respect to the environment, then the heat that will be dispersed out. And next is evaporation. So it is a continuous evaporation of moisture from the respiratory tract and from the mucosa of the mouth as well as from the skin. So here the water gets evaporated from the surfaces of our skin, that can be from the membranes or from the respiratory tract mucosa or from the mucosa of our mouth. Now factors that affect the body temperature. So first is age. So what are the things that will affect our body temperature? Okay. So first is age. Infants greatly influenced by the temperature, children more liable than adults, and elderly are extremely sensitive to environmental changes due to decreased thermoregulatory control. So here the infants that are the age group of 0 to 1 0 to 1 is neonates, 1 to 3 is infants, and here the children and the infants are mostly influenced by the temperature, then the adult and the elder are more extreme to the sensitive to the external environment, that is the changes that is been occurred in the external environment that affects the elder very closely or very immediately due to the decreased amount of the thermoregulation control in the brain. Now, diurnal variation. So, in diurnal variations, it is also known as circadian rhythms. So, it is also known as circadian rhythms. So, here the body temperature normally changes between 0.5 to 1 degree Celsius during the 24 hours of the period, and however the temperature will be one of the most stable rhythms in the human. So here it changes according to the external environment, that is the morning and late afternoon. So there will be a varying number, that is 0.5 to 1 degree Celsius between morning and the late afternoon. Now the point of the highest body temperature is usually reached between 8 p.m. and 12 midnight. So here the highest temperature that is being measured during our sleep, during the day to night time, that is between 8 p.m. to 12 midnight, and the lowest point that is measured in the body temperature, that is during the sleep between the 4 a.m. to 6 a.m., that is in the morning, early morning, that is 4 a.m. to 6 a.m. Then next point is exercise. So exercise can increase the metabolic rate, that we studied in the metabolic rate, that the movement or the activities can increases the metabolism rate and can increase the heat production too. And in any form of exercise can increases some of the heat production and such, and through that the body temperature gradually increases. Now fourth is hormones. So the hormone levels. So in women usually that they experience more hormone fluctuations than the men. The progesterone secretion in women rises the body temperature. So in women there is an hormonal variation. If the progesterone secretion is increased, then women will get temperature due to the hormone fluctuations in the women. Now fifth is stress. Epinephrine and non-epinephrine hormone increases the metabolic rate and heat production. So if the patient or a person is having a physical or emotional stress, that would lead to increase the body temperature through the hormonal as well as some of the neural stimulation in the brain. Thank you.